Senator O'Donnell.
Carly, thank you, Chairman. And I have a very specific question, Chair, conscious of time, so I'll keep it as brief as I possibly can. And I know, having discussed with my Seanad colleague, Senator Higgins, this is a question that she would have intended to ask Coochie given the COVID restrictions, and she understands and appreciates that. Building on Senator O'Reilly's question to our panel, there are public health concerns internationally, specifically around Israel's unequal distribution of vaccines and access to vaccines for Palestinians in the occupied territory. As our panel will know, a Palestinian human rights group, Al-Haq, joined by more than 100 Palestinian human rights and civil society organisations, called Israel's vaccine policy, quote, discriminatory and unlawful due to its complete disregard for its obligations toward Palestinian healthcare. I think one of our earlier contributors spoke to global apartheid in relation to the vaccines. Article 56 of the 4th Geneva Convention, Chair, stipulates the occupier has a duty to ensure to apply necessary preventative measures to combat the spread of diseases and epidemics. So far, over 172,000 Palestinians in occupied territory have tested positive for COVID, and there have been more than 1,900 deaths. So I do note the government is contributing to COVAC, as other members have said. But in keeping with the Chair's advice, I suppose my very specific question, not least in the context of Ireland's often cited and often lauded soft power on the global stage, whether that's in the context of the EU, of the UN, of the Security Council, our very historic and long-standing links with North America. I wonder if the panel could give us their views on what specifically more could be done by Ireland and this state to support Palestinian equitable access to vaccinations.
Thank you, Senator John.